Iowa, you have to kind of appreciate, is different. It's not a place in a big city with 12 other hospitals next door that siphon off interesting cases of different specific kinds. This is someplace you'll see absolutely everything, and you really won't want for any particular type of a case. And it's got a lot of the really exotic as well as a lot of the really mundane.
Fellowship leadership and division leadership really cares about everyone in the division. Fellows, faculty, patients, etc. The division is a very nice one to belong to because of that caring for everyone in it.
Very comprehensive program in terms of training for infectious diseases, followed by a large number of staff that can actually support you through your learning with different views and knowledge that you definitely need to be a good infectious disease trainee at some point.
It is often kind of moving for me to hear the fellows comment on how much they've appreciated the support they've had from our faculty, how much the spirit of collaboration that Iowa touts as being one of its features is true for them. And I think our faculty are outstanding in their commitment to the training of fellows. We try very hard to align the training with the professional goals of the trainee. And so that means, especially during our second year, we try to have that imbued with a lot of flexibility for the fellow so that they can have experiences to promote their education and training toward those professional goals.
We have 3 career paths that the fellows have a choice to pursue. They can pursue training that's stronger as an educator. They can choose a track that's more research-based, which is more basic science, and they can choose a path that's more towards epidemiology, or they can choose a track that's basically for clinical practice.
The other thing I think that's different is the flexibility in the program. We really allow fellows to kind of design how they want their experience to be during their second year based on what interests they have that develop in the first year. There's a lot of time that's flexible, and you can make kind of the program be what you want it to be.
So the University of Iowa Hospitals and Clinics is the premier referral center for the state of Iowa. The exposure that we have to patients with fascinating diagnosis is very rich. I think that is a very important component of the fellows training. And they gain experience. I think it's important to us to see that the fellows grow in their development of autonomy.
If I see a patient who I notice, in runs that might benefit from an infectious disease consult, I just tell the team, hey, I'm going to see this patient because I think my input is going to be important. And just being able to run with those teams, listening on their conversations, figure out what they are thinking, be able to give my input at the same time to the surgeons, to the transplant nephrologists, hepatologists, to the bone marrow transplant docs, makes a huge difference in the care of the patient and actually in both learning and teaching other services.
In terms of infectious diseases, we handle a pretty complex list of patients, and we can definitely learn a lot of stuff that you will never imagine you'll see in Iowa. Like even thinking tuberculosis in Iowa is like you wouldn't even think about it, and you can see quite often here.
The first year was mainly clinical. I got to kind of get used to the hospital, get to know all of the staff, and understand exactly what Iowa City was and how the hospital functioned. And then as a second year, I did research in HIV and kind of primary care and the intersection between those things. I also did a little bit of research in epidemiology of a Mycobacterium chimera outbreak that had occurred.
Our fellows are given a wide variety of options for research. Again, if they want to do basic science research, we have excellent basic scientists in our division, but they also have the option to do basic science research with faculty from other divisions or actually other departments. So that actually is a very important distinction, because they can really follow their dreams instead of having to adjust what they will do in research based on what's available in the division.
I think it's because of the nature of the personalities of the faculty who are not territorial. and very much looking for ways in which they can define projects that interact with other faculty members and make use then of a diversity of perspectives and experimental methods.
You know, little bits of research don't necessarily end up being remembered and followed forever, but they're threads, and that each thread that you weave gets added to the fabric, and after a while you have a magic carpet. And I think that's just a wonderful metaphor for very basic or very focused research.
We have faculty that only practice at the VA. Some of our faculty who do a lot of epidemiology work at the VA, and some of our faculty also do some HIV work there.
There's a number of people on the faculty who have research funding from the VA. It's an important part of the clinical experience that the fellows get.
You have access to a lot of clinical data from the VA system. And so there, some of our fellows have published wonderful work actually in the last couple of years from that database.
We're fairly unique in the nation for being a site for one of the VA Quality Scholars Program. Trainees are eligible to apply for a 2-year training experience that prepares them very well for work in hospital epidemiology and healthcare quality.
It's available for non-U.S. citizens, whereas NIH training grants are only for U.S. citizens. So we really have the opportunity to offer additional training time for those who want to go into academics.
There's quite a few things that make this different from other programs around the country. I think one of the big things is how well-rounded it is. I think we have a lot of faculty with varying interests, from microbiology to antimicrobial stewardship, to epidemiology, to basic science, clinical research. There's really a little bit of everything, and so depending on what your interests are or what your interests develop into be, we have a lot of people that can help kind of guide you.
To be honest, as soon as I left my interview, I felt this is the right place to be at, and I was completely sure that I wanted to come to Iowa.
I think it's important to find a program where you feel like the people that you'll be working with really care about you, care about what you want, your interests, your needs, and how to get you where you want to be. And I think that's one thing that we do a very good job of at the program here.
I think you'll see that we have an excellent faculty, that we provide many opportunities for trainees to gain the professional skills to be successful as ID experts.